Hi, I'm Athwal, and here we are at SiteMD on Mule Road. We're going to learn all about eye health and how we can take care of ourselves as we get older. Come on in and we'll meet Dr. Lisa Athwal. Hello, again, I'm Athwal, and here we are with Dr. Lisa Athwal, which is part of the whole company of SiteMD.
Yes.
So, Dr. Lisa, I'm always so excited to be able to interview young women that are career-oriented. It just shows a change in our times, and it's very, very good incentive for everyone. So, tell me how you even became to be an eye surgeon.
So my father is actually an ophthalmologist, as is my uncle. So you could say it's a family business. So I just grew up being exposed to ophthalmology, and I would work here at the office some summers during high school and also during college. And over time, I just began to like it more and more. So I decided to go to medical school, and I tried different things, but I always came back to ophthalmology.
Mm-hmm. And your brother's in the practice as well.
Yeah, my brother's an optometrist here.
Yes, and I met him.
Yes.
So there you go. Okay, so this is going to be more or less a Q&A session.
Okay.
Because that's the only way I really know to introduce our audience to vision health. So let's start with, what is the most common causes of vision loss?
So here we have a large senior population, and a lot of eye diseases are age-related, unfortunately. So I would say glaucoma and macular degeneration, as well as diabetes, are probably the top causes of vision loss that we see here. Also cataracts, but luckily that's reversible with cataract surgery.
How often should we get our eyes checked? As seniors, you know, we are very lax in that, almost like the dentist gets more coverage than our eyes. So tell me about that. How often should we see an eye doctor?
So I recommend definitely once a year, and then depending on whatever diagnosis a person might have, it may need to be more frequent than that, but a baseline of once a year.
Mm-hmm. Yes, okay. What are the signs of cataracts?
The first thing a lot of people notice with cataracts is glare when they're driving at night. That's a big one. And then over time, they can have more difficulty seeing road signs when they're driving, seeing the writing on the TV, reading fine print becomes harder, even with glasses. And then over time, things can just start looking a little cloudy or hazy or foggy and losing some of that color vibrancy. And that's a lot of times what people notice as they're developing cataracts.
Mm-hmm. So do cataracts are only to the senior population, or can it be a young adult that has cataracts?
So most times cataracts are age-related. So most people start to develop cataracts at some point in their 50s, and then they just slowly progress over time. But in some cases, people can be born with cataracts. Those are congenital cataracts, or people can develop cataracts from having trauma to the eye or from taking certain medications like steroids, but most times they're age-related.
Okay. Can you explain to me the difference between nearsightedness and farsighted?
So people who are nearsighted can see well up close. They're also called myopic. So they can read fine print, but they have difficulty seeing things in the distance. People who are farsighted, it's more of the opposite, although a lot of times farsighted people can't see as well in the distance either, so they really can't see very well near or far. And then there's another type of prescription called presbyopia. That's the ability to focus up close. Everybody loses that ability, usually starting in their 40s, so that's when most people start to need reading glasses. So that's something on top of nearsightedness and farsightedness that can develop.
Mm-hmm. Are you born with that? That you a predisposition for nearsightedness or farsightedness? Is that the shape of your eye, or it's just?
You can be born like that, or it can develop as people grow. So people usually become more nearsighted over time. That means their eyes elongate. And that's one of the things that can cause somebody to be nearsighted. It can also be related to the shape of the cornea. So there's a lot of things that go into it.
Mm-hmm. What's a way that I can maintain good eye health? Do I have control of that?
Well, definitely at least seeing an eye doctor once a year so that you can so that we can catch things early. If anything is developing, the earlier we catch different eye diseases and start treating them, the better. Not smoking is a big one because smoking really increases the chance of developing macular degeneration. And then just overall eating a healthy diet. A lot of green leafy vegetables are good for the eyes, and also protecting your eyes from the sunlight. Just like people put on sunscreen to protect their skin, it's good to wear sunglasses that have UV protection to protect your eyes as well.
So now we're in a computer age, and many of us are on the computers. Does screen time affect the eyes? And how can we prevent anything that would damage it being on a computer?
Well, screen time can definitely cause eye strain. It doesn't really do any permanent damage, but it can just cause discomfort. It can worsen people who have dry eyes. It's good to take breaks to avoid eye strain. So every 30 minutes or so to take a few seconds to look out in the distance, and then you can look back at your screen. There are glasses that have a filter that's a blue light blocker. Some people find that helps them with eye strain. It's not anything that you have to wear, but it can help if you do feel like you experience eye strain from screen time.
Mm-hmm. So before you mentioned glaucoma, what are the symptoms? How would I know I have it? And what do I do about it?
So unfortunately with glaucoma, a lot of times there are no symptoms, and that's why it's important to come for your regular yearly checkup, because glaucoma usually affects the peripheral vision first. So a lot of people don't notice they're losing that peripheral vision until it's too late.
Mm-hmm.
So glaucoma is caused a lot of times by high pressure in the eyes, but usually the pressure is not so high that you can feel it. Unless it's severe glaucoma or something that's called angle closure glaucoma, in that case, there can be a lot of pain from the pressure in the eye. But if it's your average open angle glaucoma, a lot of times you won't feel anything at all. You could just slowly be losing your vision and not even know it.
Mm-hmm. Are you born with that? Is it predisposition?
So some people are born with it, but usually it's an age-related disease. So for most people, the chances of developing glaucoma increase as you get older. And so a lot of people who have glaucoma are seniors. It can run in families, but it doesn't necessarily have to.
Mm-hmm. You also mentioned diabetes. How does that affect eye health?
So diabetes actually pretty much affects every organ in the body. It affects all the blood vessels, including the blood vessels in the retina, the back part of the eye. So it can cause bleeding in the retina, swelling in the retina, and that could lead to damage to the vision.
Mm-hmm. Mm-hmm. You also mentioned macular degeneration. What is that? And does that come over time? Is everyone going to get it?
Not everyone will get it, but again, it is another age-related condition. The name of the full condition is age-related macular degeneration, so it's right in the name. So it's a degenerative change in the macula, which is the center part of the retina that's responsible for your 20/20 vision. So over time, the retina, it degenerates, and that can cause a loss of your central vision. So there's different types of macular degeneration. There's a wet type and a dry type, and they're treated a little bit differently.
Mm-hmm. Mm-hmm. LASIK surgery, big deal. Can you explain to me what it is and what it's used for?
So LASIK is one of the types of surgery that can correct a glasses prescription. It's one of the types of laser vision correction. So that's mostly for people who have a glasses prescription or wear contacts, and they want to get away from having to depend on glasses and contacts. Mm-hmm. So it basically uses laser technology to reshape the surface of the eye, and that can help take away the glasses prescription.
Mm-hmm. Is everyone a candidate for that?
Not everyone is a candidate. So some people have certain medical conditions that make them not a candidate, like certain autoimmune diseases. Some people have corneas that are too thin for the surgery, so that's something that we determine through measurements. And then some people have a history of certain types of infections, like certain types of herpes infections can cause you not to be a candidate. But also the laser vision correction, it doesn't take away if somebody is developing cataracts. That's a separate thing. It's more for people who are mainly younger and want to get away from wearing glasses and contacts, because as people get older, they're going to have a change in vision anyway because of cataracts. So even if we corrected the vision, sometimes as the cataracts progress, it will change again. And then it doesn't correct both near and far vision. Usually we can only correct one. So not everyone wants that. Those people who would want to have correction for distance and near would be better off waiting until cataract surgery so they can get a special type of lens implant that can do that.
Okay. What are eye floaters? And should one be worried about it?
Eye floaters are very common. So almost everybody develops them at some point. And it's caused by a degeneration in the vitreous, which is the gel that fills the inside of the eye. So as the vitreous breaks down, it pulls away from the retina and there's condensations in the vitreous. And that's what people see when they're seeing those floaters. So that basically happens to everybody at some point where the vitreous detaches and they start seeing those floaters. It can be of concern because as the vitreous is detaching, it can pull on the retina and cause a tear in the retina, which can lead to a retinal detachment, which is serious and needs to be treated. But a lot of times the vitreous can detach without incident and it doesn't cause any issues with the retina. So if people start seeing new onset floaters or they're seeing flashing lights with the floaters, then they should come in and get it checked to make sure the retina is okay.
When you have a floater, what are you seeing? Am I seeing boats? What am I seeing?
So a lot of times people will say they thought there was like a bug or a fly in the room and they'll be swatting at something that's not actually there. Some people have larger floaters that actually can, when they come across, blur the vision. But a lot of times it will look like a black spot that comes in front of the vision and moves around, or it can even look like spider webs or lines. Sometimes people describe them. It just depends on the person.
Mm-hmm. Could this be caused by a headache?
So there are certain visual changes that can come with headaches, but that type is usually not what we're thinking of when we think of floaters. So certain types of migraines, they can come with flashing lights or different constriction of the vision or different black spots, but they usually aren't moving around as much, and then they'll go away after about half an hour. When people have floaters, unfortunately, they pretty much have them forever. But over time, they can settle down so you don't notice them as much and they don't bother you as much.
Well, recently I've been diagnosed with dry eye. Oh, what do I do about that and what caused it?
Dry eye is
Oh my, oh my.
It's one of the most common things that we see, and it is partially caused by age, but there's a lot of things that go into it. So a lot of times different medications people take have dry eye as a side effect. Certain types of autoimmune or medical problems can cause dry eye. Even just environmental causes, like if there's low humidity in the air, or when people are inside and there's a fan blowing or the heat's on, or even the air conditioning is blowing in the eyes, any of those things can really worsen dry eye. But there is a lot we can do about it. So there's over-the-counter lubricating drops, there's prescription lubricating drops. We can do something called punctal plugs, which are these microscopic little plugs that go in the tear duct and they keep your own moisture in your eye for longer. And there's even a nasal spray for dry eye that recently came out.
Yes, I saw that.
So there's a lot of different treatments.
So those plugs, that's actually an operation.
It's a procedure, but we do it in the office and it's not painful. You don't need any anesthesia or anything like
really?
that.
Mm-hmm.
And it's a quick procedure. It only takes a few minutes.
Mm-hmm. Astigmatism. What causes it? What is it? How is it corrected?
So astigmatism is caused by the cornea not being perfectly spherical. The cornea is the surface of the eye, the clear part that covers the iris, the colored part of the eye. When it's not perfectly round and spherical, it's a little bit oblong. That's what causes astigmatism. So it really just causes the light that enters the eye not to focus perfectly on the retina. And it can be easily corrected with a glasses prescription or a contact lens prescription. So that's how we usually treat it.
Mm-hmm. Well, I recently in this office had cataract surgery. What are the side effects from eye surgery? Can there be complications, or do you prepare for it? Any kind of eye surgery, not just cataracts.
Any type of surgery can always have complications. So the most common complications with eye surgery include infection in the eye, bleeding in the eye, retinal detachment. But luckily, with eye surgery, the risks of these things are very, very rare. So for something like cataract surgery, the risk of anything like that is much less than 1% chance. So the most common side effects people see after cataract surgery, there can be some swelling on the cornea, the surface of the eye, but luckily that usually clears up with drops. Dry eye can get a little bit worse while the eye is healing. And sometimes there can be an overcorrection or an undercorrection of somebody's prescription, but that can usually be corrected as well. So most of the things that can happen with eye surgery, luckily, will not cause any long-term damage to the vision. They're mostly correctable. The very serious things like infection, bleeding, or retinal detachment are so rare that over 99% of people see much better after they have cataract surgery or for whatever they're having.
And that's very true.
Yeah.
Everything is white and precise. That's for sure. Contact lenses. A lot of people go for it. They don't want to, rather than the LASIK, they just don't want to wear glasses anymore. Is everyone a candidate for contact lenses? And are there better ones as opposed to other ones?
Most people are candidates for contact lenses. They come in very high powers to low powers. Some people have such strong prescriptions or such strong astigmatism, they may not make a contact lens just off the shelf that can work for that person, but there are also specialty contact lenses that can be specifically designed for a person's eye. So most people can find some type of contact lens that works for them. So most people are a candidate, and I prefer the daily disposable lenses. I just think they're safer overall. The chance of getting an infection from them is much less because you're not putting the same lens into your eye day after day. Over time, it can build up bacteria, and that can lead to infections and things like that. So if I'm just fitting somebody in contact lenses for the first time, I usually try to steer them towards the daily disposables because they're very comfortable, and then the chance of infection with them is lower than the other.
I had a friend that changed her brown eyes to green.
They can do that too.
Right? I mean, you could do that.
Yeah.
Right. What are the most common eye infections? Most common. We know it's going to be a sty because I'm battling one now that takes forever to get rid of.
Yeah, that is one of the most common things we see. A lot of people are surprised when they get one because they've never gotten them before. But for me, I see people with styes every single day, so it's very common. And then conjunctivitis or pink eye is probably one of the other most common eye infections, and that is usually caused by different things. It can either be a bacteria, a virus, or even allergies, which isn't really an infection, but people usually think it is. So, because it has the same symptoms. Yeah.
Itchy eye and all that. Now, I'm going to try to pronounce this because my husband had it. We're not very good at pronouncing, but here we go. Chalazon was a type of sty?
So that's a chalazion.
Oh, there you go.
Yeah. So that's really pretty much just a medical term for a sty. So it's basically an inflamed, clogged up gland on your eyelid, and that's what causes a sty to form. So it can be partly from an infection, but a lot of times it really isn't infected. It's more just from inflammation.
A lot of these questions are going to be redundant. However, we have them here, so we're going to ask them. What does age cause in vision and eye health, which you really skimmed over a little bit?
So it can cause cataracts in pretty much everybody. And then in some people, it can cause glaucoma, macular degeneration. In general, people are more prone to getting diabetes as they get older. So a lot of times, diabetes and the changes we see from diabetes in the eye can be age-related. A lot of people get high blood pressure as they get older, and that can cause issues in the eye as well. So even just a lot of the medical problems people get as they get older can also have impacts on the eye.
How can we cope with a vision impairment How do we cope with that? Some
It's,
people start going blind.
yes.
Yeah.
It's hard, but there are certain types of visual tools and visual aids that can help. So I usually, will recommend different types of magnifiers for certain patients. And then beyond that, there's actually people who are low vision specialists that can evaluate a patient to see what type of visual aids beyond just magnifiers can help people. There's different types of electronic tools that can help magnify different reading material in different ways. There's different types of telescopes that can help people. And then there's a lot of things like digital clocks that can talk to a person if they can't see. So there's also the Commission for the Blind. So that's a place that people can get resources if they're losing their vision too.
So you mentioned a few times retina detachment. What causes that? And that has to be caught very early, doesn't it?
Yes. So the sooner it's caught, usually the better.
Would I be aware of it without an exam that I have retina detachment?
So the most common symptom people get with retinal detachment is new onset floaters and flashes. Also, people can see like a curtain coming down obscuring part of the vision or a sudden decrease in the vision. So those symptoms do come with retinal detachment. So it can be caused by the vitreous detachment that we talked about earlier. That can cause a tear to form in the retina, which can lead to a retinal detachment. Other things that can cause it are trauma to the eye. Certain types of diabetes can also cause certain types of retinal detachment. So there are different things that can cause them, but a lot of times if it just happens out of nowhere, it's usually related to that vitreous detachment that progressed and caused a tear to form in the retina.
Mm-hmm. So what is 20/20 vision? And I'm asking this because when I was in the exam room, there is a sign that says, this is 20/20 and this is 20/20. And the lower 20/20 was very blurred. So what is 20/20?
So 20/20 is what we consider, good average vision, that you're able to see at a distance of 20 feet what the average person can see at a distance of 20 feet. So say, for example, somebody's vision is 20/30. That means that your vision's a little bit less than average because you can see at 20 feet what the average person can see at 30 feet. So you have to be a little bit closer to see.
Mm-hmm.
So that is what 20/20 vision means. But just because you can read the letters on a 20/20 line, it doesn't always mean the letters are sharp. So you can make out the letters, but for some people, 20/20 can look like nice, sharp, crystal clear vision. And for some people, it may not look that way.
It's still 20/20.
But it's still 20/20 because you're able to read the 20/20
I was
line.
curious about that sign. I really was.
Yeah.
So now I'm a new patient. And I have an appointment with Dr. Lisa. What can I expect when I walk through that door?
So after they check you in, one of the technicians will call you back, and there are some baseline testing that they do to get you ready for your exam. So they'll usually check your vision. They'll check your eye pressure. They'll read, if you bring any glasses with you, they'll read them on a machine that tells you what prescription you're currently wearing. And then they'll do something called an auto refraction, which is another machine that you'll look into. And that machine can actually estimate what your glasses prescription should be.
Mm-hmm.
So that's usually what we can use to start out with when we're checking you for
that little barn that I saw?
Yeah, so you
they have
usually
the cutest thing that you're looking through, and there's grass on either side, and there's a barn at the end of the road.
Yeah, there can be different pictures, but that's kind of what that machine does. And then after they do all of that, either myself or the technician will do what's called a refraction if that's what you want, which is when we check you for your new glasses prescription. So that's when you look in the machine that's called a phoropter, and we put different lenses in front of you and say which one's better, number 1, number 2, and give you different options to check what your glasses prescription is. And then after that, most people are dilated at their complete eye exam. So we'll put dilating drops in the eye that will make your pupils larger, and that's how we can see to the back of the eye and check the retina and the optic nerve and everything in the back of the eye to make sure that looks healthy. So those drops can blur your vision and make you a little more sensitive to the sunlight. So you can either have a driver come with you, or a lot of people are still comfortable driving even if their eyes are dilated. You just want to be careful and bring some sunglasses with you.
Right. Because every time I come, it's dilation.
Yes.
Dilation. But that's a good thing.
Yes.
Good. Is there anything else you'd like to add? Well, we have everybody's attention.
I would just say, make sure you come for your yearly exam. We can catch things early, we can treat things early, and that will make sure you maintain good vision for the rest of your life. And I think vision is one of the most important things for quality of life for a lot of people, and we want to help you maintain that and then even improve it. So that's pretty much it.
Dr. Lisa Athwal, thank you so very much for your time. Remember, you can always reach Dr. Lisa. We're going to have a phone number for you. And the address here is 14 Mule Road, right around the corner. This is Avril for station KLVW. We'll see you next time.